So, what are these traits or characteristics that we currently refer to as borderline personality disorder? First and foremost, someone with this diagnosis has a hard time regulating their emotions. And I don't just mean moody. It's more like their emotional volume button gets stuck on the loudest setting, especially with negative emotions. So instead of getting sad, they're completely devastated. They don't just get angry or frustrated, they get rageful and desperate. And they don't know how to make these intense emotions stop without doing something drastic, which often results in self-inflicted harm. Because the emotional intensity becomes so unbearable, the temporary experience of physical pain can seem like the only way to turn down that emotional volume button. It's for the same reason that individuals with borderline personality disorder are at a higher risk for drug and alcohol abuse, since that's another way they can quickly find relief, albeit temporary, from intolerable emotions. And while it might seem like they are maybe just trying to get attention or being melodramatic when they go to such extremes to deal with their emotions, it's important to remember that their emotional volume button is stuck at 10, and it hurts, and they just want to make it stop, whatever it takes. Again though, just because someone self-harms, or drinks too much at the end of a bad day, or gets super moody sometimes, that does not mean that they have borderline personality disorder. Pretty much all of us handle our difficult emotions in ways that are not healthy from time to time. The difference is that someone with borderline personality disorder feels extreme negative emotions more often and more easily than most people, and they struggle to find healthy ways of dealing with it. For people with borderline personality disorder, relationship problems tend to be the cause of most of their negative emotions, which means people with this disorder usually have a history of stormy relationships that ultimately don't work out. You see, on the one hand, people with borderline fear rejection and abandonment more than anything else in the world. They desperately crave closeness, but when they get it, a deeply embedded fear of abandonment gets triggered, and they can react pretty aggressively. They can get mean, threatening, or even verbally abusive. So you can imagine how this combination of "I hate you, don't leave me" makes relationships really hard. Borderline personality disorder is a complicated and challenging condition without question. But I actually have some good news. It also seems to be more treatable than most other personality disorders. Dialectical Behavioral Therapy, or DBT, was created specifically for borderline personality disorder, and it can be really effective at helping people learn how to manage their emotions in healthier ways. Borderline personality disorder also seems to respond better to medication than other personality disorders. And because the majority of people diagnosed with this disorder have trauma somewhere in their history, there's pretty good research showing that EMDR and similar therapies can also help reduce some of that emotional intensity and fear of abandonment. So if what I just described sounds like you or someone you know, I would encourage you to find a therapist who specializes in diagnosing and treating disorders that affect emotional regulation. There are even entire clinics that focus exclusively on helping people learn how to regulate their emotions and develop skills for handling tough situations so that they can have healthier relationships with themselves and with other people.